Now, after removing the pectoral fascia, what you see is the pectoral muscles. Now, pectoral muscles are number one. The first one that you see is the pectoralis major. The pectoralis major arises from the anterior surface of the clavicle, the medial 2/3 of the anterior surface of the clavicle. So, these are the clavicular fibers. It also arises from the anterior surface of the sternum, anterior surface of the lateral end of the sternum, as well as from the costal cartilages, that is from the 2nd to the 6th costal cartilages. And the lower fibers, they are the aponeurosis of an abdominal muscle which is called the external oblique muscle. So, together you have the sternal fibers, the clavicular fibers, the sternocostal fibers that arises from the lateral end of the anterior surface of the sternum, as well as from the 2nd to the 6th costal cartilages. And the lower fibers, they are aponeurosis of the abdominal muscle, that is the external oblique. All these fibers, you can see, they converge on to the lateral lip of the intertubercular sulcus on the humerus. So, there is a lateral lip and a medial lip. The muscles converge on to the lateral lip of the intertubercular sulcus, and we can see that the origin is very extensive, but the insertion is narrow. And you can also see that the upper fibers that are coming from the clavicle and the sternum, they are inserted into the lower part of the lateral lip of intertubercular sulcus, whereas the aponeurosis fibers, they are inserted onto the upper part of the intertubercular sulcus. So, this is the origin of an insertion of the fibers. So, what will be the action? Naturally, some of the fibers are coming from the axial skeleton and being inserted onto the humerus. So, what will be the action of these muscles? Now, action will be naturally adduction, because these fibers, they will pull the upper limb towards the center. Adduction, medial rotation and flexion. And what is the nerve supply? The nerve supply is medial and lateral pectoral nerves. Nerve supply is both medial and lateral pectoral nerves. So, with this we finish with the first muscle, that is the pectoralis major. Now, after removing the pectoralis major, just below the pectoralis major, we see another muscle, that is the pectoralis minor muscle. Now, it is much smaller than the major muscle, and it arises directly from the ribs, not the costal cartilages. Please note that it arises from the ribs, that is from the 3rd to the 3rd, 4th and 5th rib. So, this is going and inserting onto the 3rd rib, from the 3rd rib, 4th rib and the 5th rib, and this is inserted onto a process that is known as the coracoid process. It is inserted onto the coracoid process. So, this is a small muscle, and that is called the pectoralis minor. The importance of pectoralis minor is that it divides the axillary artery into 3 parts. It divides the axillary artery into 3 parts, and the first part of the axillary artery lies above the pectoralis minor. The second part lies behind the pectoralis minor, and the third part lies below the pectoralis minor. So, pectoralis minor is the main muscle that divides the artery into 3 parts. So, it is a landmark muscle. Now, pectoralis minor is supplied by the medial pectoral nerve, and the medial pectoral nerve supplied by the medial pectoral nerve. Medial pectoral nerve pierces the muscle and supplies it. It is a branch of the medial cord of the brachial plexus. So, what is the function of this muscle? This muscle mainly assists the serratus anterior in functions like protraction of the scapula. So, with that we finish the pectoralis minor also. So, it arises from the 3rd, 4th and 5th ribs and is inserted onto the coracoid process.